Thank you all for attending today's webinar. I'm Lydia Ross and I'm the Assistant Secretary of the Carers, Autism and Early Childhood Branch in the Department of Health, Disability and Ageing. Thank you all for joining us today for this information session on the Integrated Carer Support Service, Carer Gateway Service Providers Grant Opportunity. To support this briefing, I'm joined by our Auslan interpreters, Naomi and Therese. Attendees can also enable live captions if they wish by selecting More Actions in your meeting controls and selecting the Language and Speech option. I'll begin by acknowledging the traditional custodians of the lands that we're meeting on virtually today. I'm based in Canberra on the lands of the Ngunnawal people. I acknowledge and pay respect to their continuing culture and contribution to the life of this city and this region. I also extend that acknowledgement and respect to other families with a connection to this region and any other Aboriginal or Torres Strait Islander people who are with us today. Today's session is about helping you understand whether this grant is right for your organisation and what a strong application looks like. It is intended to assist potential applicants in understanding the grant opportunity guidelines and how best to prepare strong applications aligned with the priority outcome areas outlined in the National Carer Strategy. A reminder for transparency and record keeping, this session is being recorded and will be published on our website. By joining the session, you consent to being recorded. Over the next 10 minutes or so, we'll share a pre-recorded video explaining the context and purpose of the Integrated Carer Support Service Carer Gateway program, including an overview of the National Carer Strategy. We'll also go through the funding available, eligibility and assessment criteria, and the application process. Then we'll have some time for questions. There's no option for attendees to turn on their video or microphone, and you can submit your questions by clicking on the QA icon at the top right-hand side of your screen. We'll attempt to respond to as many questions as possible here during the session, but questions submitted during the process have also been considered for the QA, and all questions and answers, including the ones we may not get to today, will be published on the FAQ document on Grant Connect after the webinar. If we're unable to get to your question during the session, we will follow up with the relevant area in the department and we'll respond through the FAQ document. Finally, a reminder to keep the discussion respectful and professional. Please be courteous in your questions and comments so that everyone has a positive experience. We're now going to start the recording, the basic information on the grant opportunity and on the National Carer Strategy. The Integrated Carer Support Service, or ICSS for short, aims to improve carer wellbeing, build carers' capacity, and support their social and economic participation. Carer Gateway is the central component of ICSS and has provided free, locally delivered supports to unpaid carers across Australia since April 2020. Designed by carers for carers, Carer Gateway provides early intervention, preventative and tailored supports to help carers manage daily challenges, reduce stress and plan for the future. Services are available to carers as defined by the Carer Recognition Act 2010 and are prioritised based on individual need. Current grant agreements end on 30 June 2027. This new grant opportunity is designed to maintain continuity of Carer Gateway services and improve access and outcomes for carers in line with the National Carer Strategy. Carer Gateway provides early intervention, preventative and skill-building supports to improve wellbeing and long-term outcomes for Australia's 3 million unpaid carers. It was designed to shift from a crisis-driven model to one that supports carers earlier in their caring journey. An evaluation by the Social Policy Research Centre found the program has broadly achieved this intent, with carers receiving preventative services needing emergency support about half as often as those who did not. These findings also inform the National Carer Strategy and its first action plan. Before outlining the grant program in more detail, it's important to explain its link to the National Carer Strategy. Launched in December 2024 and designed with carers, the strategy sets a national agenda to improve awareness, recognition and support for Australia's unpaid carers. Since the action plan was released, progress through Carer Gateway has included making an additional 10,000 free phone counselling sessions available for carers every year, increasing access to peer support, and delivering pre-vocational support for carers across Australia to help carers prepare for, find and maintain paid employment that works with their caring role. This grant opportunity supports the strategy by improving the inclusivity, accessibility and choice of Carer Gateway services, including through expanded business hours, 3 new service areas for regional and remote carers, improved accessibility and greater carer choice in providers for services, particularly counselling and respite. Further work is underway to improve mental health support, respite arrangements and peer support. Over the 5-year grant period, the Department will continue working with Carer Gateway service providers to refine services to improve support for carers. This grant opportunity will select providers to deliver Carer Gateway supports for unpaid carers across 19 service areas. A map of service areas is included in the grant opportunity guidelines. 1 provider will be selected for each service area, although applicants can apply for and be selected for multiple service areas. Carer Gateway services include support planning, counselling, coaching, training, peer support, tailored support packages, referrals to planned and emergency respite, navigation assistance and information and advice. Successful providers must deliver all listed service types within the service area with flexibility in delivery models and funding allocation. Services must be prioritised and delivered based on carer needs, and providers will need to monitor local demand, allocate resources to maximise outcomes, and adapt service delivery over time as needs and support options change. Providers must also maintain outreach and connections with social, health, education, community and cultural groups to understand local carer cohorts, including regional, rural and remote carers, and the priorities cohorts identified in the National Carer Strategy. All services must be delivered in line with the Carer Gateway Service Provider Operating Manual, which is available with the grant opportunity documents on Grant Connect. Carer Gateway aims to improve unpaid carers' wellbeing, build their capacity to care, and support their social and economic participation through effective preventative supports. Carer Gateway service providers are expected to deliver services that are inclusive, accessible, timely, and responsive to carers' individual needs, that are effective in improving wellbeing, including social and economic participation, and that are preventative, carer-centred, evidence-based, efficient and effective. Up to $951,732,965 is available over 5 years for this grant opportunity. Indicative funding for each service area is outlined in the grant opportunity guidelines. Applicants are expected to identify efficiencies, particularly when applying for multiple service areas. Final funding allocations will be confirmed when offers are made to successful applicants. To be eligible to apply for this grant opportunity, your organisation must be one of the eligible entity types listed in the grant opportunity guidelines. Importantly, you are not eligible to apply for this grant opportunity if you are included on the National Redress Scheme's website on the list of institutions that have not joined or signified their intent to join the scheme, or if you're an organisation that has not complied with the Workplace Gender Equality Act 2012 and is included on the non-compliant organisations list on the Workplace Gender Equality Agency website, or if your organisation or any of your key personnel are subject to a banning order in force under the NDIS Act. The grant opportunity guidelines contain further details if you're unsure of your eligibility to apply. Organisations can apply as a consortium to deliver Carer Gateway services. In a consortium, one eligible lead organisation must be solely accountable to the Commonwealth for delivering the grant activities. Only the lead organisation can submit the application and enter into the grant agreement. Eligible organisations may partner with ineligible organisations, except where an organisation is ineligible because it is not joined or signalled its intent to join the National Redress Scheme. It is listed as non-compliant under the Workplace Gender Equality Act 2012, or is subject to an active banning order under the NDIS Act. The grant opportunity has 3 assessment criteria to evaluate how well your organisation will meet the grant requirements and contribute to the objectives and outcomes of the grant opportunity. Your organisation's capacity and capability to deliver Carer Gateway and meet the needs of unpaid carers, and how well your organisation will use grant funds efficiently and economically. The grant opportunity guidelines explain what responses must include and what makes a strong response. Responses are limited to 3,500 characters per criterion, or about 525 words. Applicants also must complete the business model, risk management plan, and indicative activity budget templates available on Grant Connect. Each criterion will be scored from 1 to 5 for a maximum total score of 15. Applications must score at least 4 against each criterion to be considered for funding. To apply, you must first read the grant opportunity documents on Grant Connect and decide which service area or areas you wish to apply for. Applications must be submitted through the online form, and you must submit a separate application for each service area you want to apply for. Any economies of scale or other benefits you propose from delivering across multiple service areas should be explained in the business model template in the attachment pack, which includes an option for additional sections for this purpose. After the grant opportunity closes, assessment is expected to take about 10 weeks, depending on application volume. The department will then finalise approvals and negotiate and award grants. Successful applicants may begin activities to transition into service areas from March 2027 and need to be ready to start delivering services from 1 July 2027. Okay, everyone, that's provided you all with some of the background for the grant opportunity and how it relates to the National Carer Strategy. I'm now going to open up for questions. Please use the Q&A function in the meeting. You'll see that at the top of your screen. And we'll get started. So we have a question about Carer Star and Carer Star licenses. We are not planning on making any changes to how Carer Star will operate within the program. So licenses will be covered as they are in the current grant period.
Hi, Lydia and other attendees. It's Lauren from Carer Programs. It seems that some of the questions are just taking a minute to get through to Lydia, so I might read some of what we have coming through.
That's all right. I've now got heaps of them.
You've got heaps? Great. All right. If you need me to jump in, let me know.
So we have a question about the number of carers supported. And the question is the number of carers capped each year? The answer is no, there are no caps on how many carers can be supported, but the successful applicants will be required to operate to their budget and to prioritise support for carers within that budget. There's a question about whether incorporated charities without deductible gift tax receipt or ACNC status are eligible to apply. That's something I will need to double check. So we will come back with a response to that question in the FAQ document on Grant Connect. We've got a question about access to emergency respite. Should the Carer Gateway service provider plan to provide emergency respite, or is the role only to refer or assist in accessing existing services? The answer to that is we don't mind either way. The important thing is that the carer is assisted to access respite when they need it. Providers are welcome to deliver emergency respite themselves if they wish. You should make that clear in your application. If you are not providing emergency respite, you will need to be able to demonstrate that you have the relationships in place to help carers access respite quickly when they need to. There is no cap on the funding for emergency respite per client or per instance. As I said, the providers are expected to manage within their budget and to think about equity across the carer cohort they are supporting. And we also expect that the prices providers are paying for services are reasonable market prices. There's a question about wording between the grant opportunity guidelines and the operating manual. We will look into that and provide a written response in the FAQ document. There's some questions about the character limit for grant applications. That is a strict limit, and we encourage you to put your best foot forward within that character limit, but please use the attachments to flesh out the value that you are proposing to deliver should you be the successful applicant. Someone has asked about indicative costings for establishment as part of Year 1 funding and how that would be presented in the AWP or Activity Work Plan template. That would be something that we would work through with the successful applicants once decisions are made. If we can provide more detail, we will do that in the FAQ document. Someone has asked whether Carer Gateway funding is subject to indexation. For anyone who is not aware, that's a process the Commonwealth uses to increase funding within a program to reflect increases, to reflect inflation, to maintain purchasing power, and Carer Gateway is subject to indexation. Someone has asked about regional and remote costs in the activity budget. That is to reflect additional service costs, extra costs for doing business in regional and remote areas. Definition of indirect and direct costs. We'll provide something concrete in the FAQ document, but those are, it's about what is paid directly by the organisation versus through brokerage arrangements. We have questions about one of the key performance indicators, the KPI number 2, which is the time between intake and first assessment. The question is intake defined as the first point of contact, or is it from the first carer star assessment? Intake is where the provider gathers basic information about a carer who has decided they would like to be supported through Carer Gateway. It's not necessarily the first phone call or contact a provider has had with that individual, but it is about getting the basic information about the carer, their name, their address, the fact that they would like services into your system. And then the assessment refers to the first carer star assessment. The question about expectations on the outcome framework measures in respondents' business models. Are respondents expected to address all identified measures or a subset relevant to their model? outcomes framework measures relate to the program. So anyone who is delivering the program needs to be able to cover what is included in that framework. However, we are very open to different business models and methods of achieving those outcomes. Respondents are respondents required to propose targets for each measure, or is target setting at the respondent's discretion? And where targets are proposed, is there an expected level of specificity, for example, quantified numeric targets versus indicative directional commitments? So at the application stage, we are looking to get a sense of how you propose to deliver Carer Gateway as a program. You need to be able to demonstrate how you will contribute to achieving the outcomes in the outcomes framework. And it really is up to applicants how they best describe that. In terms of targets, expectations for a specific service area, they will be agreed with a successful grant applicant. But we would encourage you to be as specific as you can about what you think you will be able to measure and what you think you will be able to deliver. Regarding the current Carer Gateway service providers, the question is approximately what percentage use a consortium or subcontracting model to deliver the program? I'm not going to go into details about the business models of existing providers. The program allows for consortia to apply for this grant opportunity. It is also open to a provider, be that one organisation or a consortium, to enter into partnership arrangements or brokerage arrangements to deliver services. There are some rules around that, but we would expect that all providers have relationships that will enable them to deliver services in their service area. We also anticipate that those relationships will change over time over the course of the grant period. Will we be making copies of this recording and transcripts available to participants? We are recording this session. It will be up on our website so that you can come back and watch again, or anyone who was not able to participate today can view the session and get the same information as people who were here this morning. There's a question here saying that the attachments option is not enabled on the Gateway application portal. Can this be fixed, please? We will look into that. As I understand it, the mandatory attachments that we require for the grant application are available and able to be accessed, but we will check into that. Any issue will be rectified and we'll put something in the FAQ accordingly. There's a question about funding allocations. That funding allocations are based on historical demand in the 2021 census and estimated carer populations. The question is, what mechanisms will be in place if demand significantly exceeds projections in a service area, particularly for tailored support packages and emergency respite? So this is a challenge. Estimating demand for this program is difficult, but the model is that there is a budget available for each service area, and we are looking for providers who can best manage that budget and deliver the best outcomes for as many carers as possible within their service regions. Will be up for to providers to be managing that budget and prioritising across the carer cohort in the service area. There's a question about establishment costs for new providers. The question is, To confirm that establishment costs for new providers are included in Year 1 funding. Is that establishment funding additional to the published Year 1 service envelope for the area or drawn from it? And does the earlier March 2027 start for new grantees carry any funding for that establishment quarter beyond the 5-year envelope, given all agreements end by 30 June 2032? We will answer that one in writing, so please refer to the FAQ document. I will say that transition arrangements in each service area will need to be established based on the outcome of the grant application process, and the readiness of the new provider to commence, and the transition out requirements that the existing provider will need to enact. The question about brokered services. Are brokered services presented as direct or indirect client costs as per the budget template? I might have to come back to you on that one. So please refer to the FAQ for an answer. I don't want to go too far wrong on that, but it's getting into some quite technical detail. For the multi-service areas applications, you said there's an option to add additional tabs. Is this in the form of a business model template and indicative budget for each additional or combined service area? So we will want to see the details of your business model and budget for each service area that you are applying for. Where you are applying for more than one, we need to see in those documents what efficiencies or other benefits you are proposing to deliver if you are successful in getting business across more than one service area. But you will need to submit an application for each service area that you are interested in receiving business for. The question, can you please clarify who will be responsible for managing the 1-800 number if one organisation is applying for only one region or two? The 1-800 number is managed nationally, and there's a separate funding arrangement in place for that service. For the new remote areas, where the funding envelope is very small, is it intended that the majority of these services would be virtual? That is not the intention. We are looking to applicants to tell us how they intend providing services to carers in each of the service areas they're applying for. That includes regional and remote service areas. And we are not intending that only digital services are available to people who are living outside of metropolitan areas. How providers propose to deliver high quality and effective services in regional and remote areas will be one of the things we're looking for in a quality application. There's a question about the sample grant agreement. As the sample grant agreement provides for payment in quarterly milestone instalments, and FAQ 2.5 states that the payments follows execution of the agreement and the agreed payment schedule. The detailed question about how payments will roll out if a new provider is commencing in a service area, we will respond to that one in writing to make sure we can address all of the elements really clearly. As a question about alternate tenders, are alternate tenders permitted? I might need just a little bit more information about what is sitting behind that question. So if that's your question, if you wouldn't mind elaborating a little, be happy to respond. There's a question about pre-employment training and support services. And it's asking for clarification if pre-employment training and support services are delivered by service providers, or are service providers able to refer to appropriate other providers? The answer to that is either. Either business model or approach is allowable under our model. We just need you to be clear about what you're proposing in your application and what you would see are the benefits of the method that you are proposing. It would also be open to providers to use a mix of those two approaches. There's a question about how carer records, DEX histories. For those of you who are not currently operating the program, DEX is the data system that we use for reporting for the program, and key performance indicator baselines be treated at commencement of the new agreement. Specifically, where service areas change provider, does the carer's DEX history transfer to the incoming provider? Do existing carer assessments carry over? If reassessment is required, does it reset the KPI? The question goes on to ask a number of other elements. I'll give a high-level response here and we will respond in detail in the FAQ. So the first thing is that the key performance indicators will reset. It is a new grant agreement and performance will be measured from the commencement of that new grant agreement. It's a little bit different in terms of carer data, existing assessments, existing support plans. All of those issues will need to be worked out as part of the transition planning process. The intention is that transition in service areas where the provider is changing is as smooth as possible from the carer's perspective. And we will be looking to work with the existing provider and the new provider to achieve that as best as possible and to reduce the need for the carer to provide information again that they have already provided. There's a question about how to complete the risk management template in the attachment pack. Yes, if you are submitting applications across more than one service area, each application needs to be able to stand alone. We will be assessing applications for each service area. So you do need to complete your risk assessment, or you need to complete all of the mandatory attachments for each application. Hesitate to say it, but I'm not sure that I have any more questions on the list at the moment. Is there anything else that people are interested to know? Or Lauren, do we have any questions that were submitted before the session that I can respond to now?
Yeah, we have one, well, it's a two-parter from before the session that we could also respond to. So the first half is in regards to applying within a service area as an individual organisation or as part of a consortium. So the first part is, can an organisation be a sole provider in a service region as well as the lead in a consortium in the same service region?
The answer is yes, you could apply that way. I'm not sure how much sense that makes, but you are free to do so. Each of those applications would be assessed on its merits and may or may not be the successful application. I would wonder whether an organisation, have you thought through why you're entering into a consortium? If you are also happy to be a sole provider in the service area, you are welcome to propose both models. If you do so, I think it would be a good idea if you make it clear in each application what the benefits of that option are relative to the other.
Thanks, Lydia. The second part is quite similar, and I think we will get a quite similar answer. Can an organisation be a sole provider in a service region as well as a subcontractor in a consortium in the same service region?
Yes, you can, absolutely. There's nothing to stop you proposing that. As I said, make sure each of the applications that you're involved with present a really clear picture of what the benefit and the value from what you are proposing, how that will be delivered, what that looks like. But you can be a subcontractor in one application and a sole provider in another. Are there other questions we received prior? Here we go. There's a question about, are there any items from the Carer Gateway performance report that we would highlight for providers as part of this process? That's a good question, and it goes to what do we think good looks like from this program. We've got a fair bit of program history now. I would encourage providers to think about their customer service element of how they operate. That's important. So those are things like how well do you respond when carers are approaching you for help, how you interact with carers, what that experience is like from a customer perspective. I think that there are some lessons about how good relationships in your service area and good intelligence within your service area about demand patterns and about the service options that are available. That is all to the good for a provider. And also, I think it's worth looking at the patterns over time within the program. Past performance is not a guarantee of future, but it gives you a good sense, I think, of how the program has developed over time and therefore what we might expect to see over the next few years. There's a question about an evaluation which identified Carer Gateway service providers that sometimes service providers are providing information, advice and referral supports to people who are, in inverted commas, not quite eligible. And the question is, has this been incorporated into the budget and KPI considerations for the new grant round? The answer is yes. We expect that people will approach Carer Gateway and ask questions or need information or referral who don't necessarily fit the eligibility for services more broadly within the program. We expect that providers will respond to those requests for information or advice well and in good faith, and that is taken into account in terms of the program design. The question, do we intend to have any more information sessions like this? We don't have any additional scheduled at this time. If there is demand, we can certainly look to put another session in place. But I'd remind everyone this session is being recorded and will be available for future reference for participants today and for those who could not join us. There's a question about the risk management plan. The question is the risk management plan intended to capture the applicant's most material strategic risks with operational risk managed under the grantee's own risk management framework? And then a comment that limiting the attachment template to 3 to 5 risks with a per field character limit makes this challenging for a program of this scale. When criterion 2 asks for a thorough analysis of all identified risks. We will provide some guidance on that in the FAQ in writing so that everyone can see the detail. Lauren, do you have any others from prior to the session that we could address now?
I don't have any others that we haven't already addressed. It looks like we've had a little lull in the Q&A. We'll maybe give it a minute because we have seen a couple of delays just to make sure that we address everyone's questions, noting we've got about 15 minutes left in the session.
Well, now's a good opportunity. I'd encourage anyone who has something on their mind to ask, and we will do our best to answer. Otherwise, Lauren, are you able to share any high-level information about the kinds of questions that have been coming through Grant Connect?
Yeah, I can do. Just give me one moment.
While you're doing that, there's another question that has come through. Can the department confirm the process and timing for engaging brokered or subcontracted specialist providers, and whether those arrangements can be set up during the establishment period from March 2027? So we would encourage providers to have relationships in place at the earliest possible opportunity. There are some rules around subcontracting. Subcontracting arrangements will need you need to inform the department and have those approved. But brokerage arrangements can be entered into at any time. It really is a business decision for you to think about when you want to be putting those formalities in place. There's nothing to stop you doing it earlier than the commencement of the grant period. What is important from our perspective is that providers are ready to support carers as soon as the grant period commences. There's a question about how the department will assess providers' coverage of smaller, high-need carer cohorts under the equity expectations, and does a formal partnership with an experienced specialist provider count in a provider's favour in criterion 1 and criterion 2? Our priority is that we can be confident that smaller and high-need carer cohorts, or all cohorts of carers, can be provided by the applicant. We don't have a view on how providers set themselves up to achieve that. So it is open to applicants to have relationships with specialist providers in order to demonstrate their ability to support specialised cohorts. But it is not necessary if they have other means of providing that level of support. There's a question about, does the department have any benchmarks of a good application? For example, how many carers an organisation is realistically able to reach? The answer to that is, unfortunately, no. We do not have a preconceived idea of what a great application looks like. We currently have providers that take different approaches to issues, that have different business models, and all of those business models work quite well. We don't intend dictating to providers how they go about achieving the outcomes we are looking for. It is up to you to think through what you can offer in that respect. And in terms of how many carers an organisation is realistically able to reach, again, we don't have a view on that. We expect that providers delivering Carer Gateway will be actively seeking to engage with carers, particularly carers that need support. Research tells us that carers sometimes don't know that there are supports available. They don't necessarily identify with the term carer, and that outreach from organisations is important to identify people who have a need for the program and help them connect to the supports that they need. That is a core element of what we are looking for through this grant agreement, but we do not have an idea of a set number of carers in any given service area. There's a question about, can existing subcontractor and brokerage relationships carry into the new agreement, or does every arrangement need fresh approval from July 2027? Brokerage relationships don't need approval. Subcontracting arrangements would need approval for the new grant period. However, if they are existing relationships, that approval process will be streamlined and should not take a long time. We are open to working with organisations that are successful to get those things in place prior to 1 July as part of the transition process, should that be the outcome of the application and assessment process. There's a question about, are we able to share any insights beyond the ICSS evaluation about the effectiveness of the Carer Star in practice? I'm not sure I can provide much on that. I would need a bit more detail around what the poster is really interested in knowing. The Carer Star plays a specific role in our program. It helps us be assured that needs conversations are happening in a comprehensive and consistent way across the program. It also helps us measure outcomes in terms of wellbeing outcomes for carers. That's the role it plays in the program design. More detail than that about the Carer Star as a tool, I'd be happy to answer more detailed questions in the FAQ if people have them. I think that's about all I can say in today's session. And then there's a question about when will the department be able to respond to the questions that have been asked but not able to be answered today. We will endeavour to do that as quickly as possible. We are conscious that people are actively working on their applications right now, and the application period is limited. We will endeavour to get you all the information you have asked for as soon as possible. Do we have other questions? We have just a few minutes left in today's session. Is there a prescribed percentage of the total grant funding that must be allocated to direct carer supports? The answer is no, but the proportions or the amount of funding providers are proposing to use on direct carer supports versus administration is one of the considerations we will have in terms of assessing value for money and the relative merits of applications. There's another question about how will the department gauge what is a realistic level of service delivery in a region in order to compare potential applications? Is there evidence applicants should consider including to support their projections? And they've commented they are conscious that the template does not have a lot of room for documenting detailed assumptions for transparency. So we have the program history to tell us at least what has happened in the past in terms of demand and service activity in service regions. We will be reliant on what applicants provide in their application in order to assess the relevant relative merits of those applications. And we will use our knowledge of the program history and what we know from other consultation and research processes in order to assess whether the claims that applicants are making are plausible in our view. I would encourage you, if you haven't already, to look at the National Carer Strategy section on our department's website. There are a range of reports there which come out of the consultation process in developing the strategy that go to care and need and so forth, and encourage you to do your own research and form your own views about what you think you can realistically do with the program money in a given service area, and to present that as clearly as you can in your application. All right, I think it might be time for us to wrap up. Thank you all very much for joining us today and for all of the questions you submitted. I hope this has been helpful for you in considering whether or not to apply for the grant opportunity. Once the session recording is available on our website, we will add a link to it on the grant opportunity documents on Grant Connect. As I said, we will also endeavour to answer all of the questions that were asked today that we haven't answered in full in the FAQ document. And I would encourage you and anyone else who is interested in applying to keep a close eye on Grant Connect and on the FAQ in particular, so that you can see new questions and answers as they're flowing through. If you need technical assistance in submitting your application, you can call 1300 484 145 Monday to Friday between 9 a.m. and 5 p.m. Canberra local time. If you have other questions about the grant, you can submit them by email to grant.atm@health.gov.au. Those contacts are also available in the documentation on Grant Connect. Thank you very much, everyone, and I'm very much looking forward to reading your applications as they come through. Bye.